Hi, my name is Sahil Parikh from Columbia University in New York City. I'm an interventional cardiologist. The LIFE-BTK was a randomized trial comparing a drug-eluting resorbable scaffold, essentially a bioabsorbable stent, compared to an angioplasty technique for the treatment of infrapopliteal disease. The rationale for the trial was that the standard of care from an endovascular standpoint for treatment of patients with chronic limb-threatening ischemia or CLTI has always been to do an intervention to restore flow from the aorta all the way to the target tissue in the foot. In the infrapopliteal circulation, the vessels are small caliber, and all we really had from a clinical standpoint was angioplasty as a standard of care, but that technique was always plagued by early restenosis and failure of maintenance of patency. And patients wind up coming back for repeat revascularization procedures frequently. And in that process, there was often limb loss associated with those complications. So the rationale for developing a drug-eluting device was to reduce the risk of intimal hyperplasia, and using a bioresorbable drug-eluting scaffold, the idea was to provide enough support for the artery with drug delivery to prevent intimal hyperplasia and keep the artery open long enough to heal the wound, as it were, in the CLTI patient. So this technique was developed first for coronary application and then subsequently has been adapted with a next generation device now called the Esprit BTK scaffold. The Esprit device is a bioresorbable drug-eluting scaffold. It is made in a similar size matrix of coronary stents. The shortest that we have is 18 millimeters in a diameter of 2.5. It goes to 3.75 millimeters in diameter up to a length of 38 millimeters. So still by peripheral standards, it's a relatively short device, but it's similar to the coronary predicate device on which it was based. The trial was randomized 2-to-1 to patients who received Esprit, which was a scaffold, compared to angioplasty, in patients who had either Rutherford IV disease, meaning rest pain, or Rutherford V minor tissue loss with infrapopliteal artery disease. Patients were basically equally distributed in the trial 2-to-1 across 50 sites globally, and we had patients at 1, 2 years, and now 3 years presented here at TCT. So the patients selected for LIFE-BTK were those who had critical limb ischemia or chronic limb-threatening ischemia. That means they had ischemic rest pain or they had minor tissue loss in the setting of obstructive atherosclerosis. This is basically a day in the life of every vascular surgeon or interventional cardiologist that takes care of vascular patients. We had in the study population a roughly even split between the so-called rest pain Rutherford IV patient and the minor tissue loss Rutherford V patient. So at 1 year, we showed a difference in a composite endpoint between the Esprit group and the angioplasty group of roughly 30%. And the primary endpoint included a composite of amputation of the ipsilateral side, target vessel failure, which is a target lesion revascularization or occlusion, and binary restenosis. So that difference of 30% was roughly preserved at 2 years. And here at 3 years, we show that there's been slight regression, but still about a 20% difference between the Esprit group and angioplasty. And so that is a statistically significant result. It's clinically quite significant. And amongst the components of that primary endpoint, clinically driven TLR, in other words, the reason a patient would come back is for repeat revascularization, was less than half in the Esprit group compared to the angioplasty group. So there was both patency advantage and clinically relevant clinical endpoints in favor of Esprit over angioplasty. It's the first device that's shown a statistically significant result in the infrapopliteal circulation. Certainly at 1 year, we were pleasantly surprised. At 2 years, I think we're able to determine that this is a durable treatment. And at 3 years, it's actually a surprisingly durable treatment. This is a patient population in which there's a very high risk of comorbid illness and mortality. And to see these patients have reduction in repeat revascularization, patency, and no need for amputation at 3 years is rather extraordinary. I think the Esprit BTK scaffold is the first device that's shown in a randomized head-to-head trial superiority to angioplasty in the infrapopliteal circulation. I think, whereas angioplasty was once the standard of care, I think this application of Esprit BTK is now I think, in my opinion, as a standard of care device for the treatment of infrapopliteal disease. So for practitioners, we finally have an on-label device that's now FDA approved in the US for treatment of these patients, apart from angioplasty. So that's the first thing. The second thing is I think that we see surprising durability. Many devices have been shown to have some patency advantage at short time points, maybe 6 months, maybe a year even. But nothing has shown this kind of durability all the way out to 36 months. And honestly, the device at 36 months has resorbed. And so it leaves essentially nothing behind in the artery, leaving future options, be it endovascular intervention or surgery, completely feasible.